Welcome back to the Chronicles of a Ghanaian Diaspora Nurse, The Return. Thank you so much for tuning in again. Today I have with me a very dynamic young woman who is making waves in the field of mental health care delivery and mental health advocacy in Ghana. She's going to talk about the work that she does, and also we'll listen to her perspectives on the African diaspora healthcare professionals' contribution towards healthcare delivery in Ghana. So thank you for coming, Patience, and sharing your thoughts with us.
Thank you. Thank you so much for having me on the program, and I'm excited to be part of it. As you mentioned, my name is Patience Agyare. I'm a registered mental health nurse working in one of Ghana's premier psychiatric facilities in West Africa. And talking about my job role, currently I am working as a nurse manager in one of the wards and managing a staff team of about 24. In addition to that, I also work as a mental health advocate. Anybody who knows me knows that I'm so passionate about mental health advocacy. And with that, what I do specifically, if I'm not on the ward working as a nurse manager, what I do is reach out to schools, communities, churches, organizations, and individuals who may be dealing with one emotional distress or the other. And what I do basically is to support and assist them with tools and strategies which they can use to take care of themselves in order to achieve a balance with their mental health in general. And so, in addition to that, I also occasionally find myself facilitating workshops and trainings also within the mental health space as well. So, that is basically about my job role.
Thank you so much. But before you continue, can I just ask, how long have you been a mental health nurse for?
I've been working since April 2009. That's about a little over 12 years, maybe. Yeah, so actively as a clinician, I've been practicing as a mental health nurse a decade and over. Yeah.
And you know what? I'm not surprised at all about your passion that you have for mental health nursing. So let's take a look at this clip and then we'll come back and talk about it.
And from the definition of mental health, it's saying that it is a state of complete physical, emotional, psychological, and spiritual well-being of an individual, okay? And not just merely the absence of disease or infirmity. So that you realize that a physical condition, any form of physical condition, produces one or more of a mental health problem. You understand? Reassurance, okay? Reassurance to stabilize the psychological state. Most people in the society think that once they have a mentally ill patient in the society, the patient is a prone and threat to their lives, so they are scared, they are feared for the patient, and so they kind of shun the patient, okay? And this alone makes it difficult in the curing process, curing the patient from their illness.
Okay, so from the clip, can you tell us what was going on at that time? This was when you were, just a little bit of background. This was 2007, and you were a second year student. So we had
Yes,
come to, we came to deliver some training, and there was a debate between physical health and mental health. And yeah, you were really passionate at that time. So can you tell us a bit around what was happening there?
right. Really, this video really brought some very beautiful memories to me right now, and I appreciate you sharing this with me. you know, it goes to speak to, my my passion about mental health, because growing up, I used to see persons with mental health experiences by the roadside, and I kept asking questions, why are they there? All I kept hearing was, oh, they are not well. And I'm like, if they're not well, they have to go to the hospital. And my curiosity led me to discover that actually there is a program that I can do, be trained, and then I can support such individuals. So I said, yes, I want to be a mental health nurse. That is what I want to do. And so, looking back at that particular clip, um, in fact, I didn't know how best to just, communicate to my colleagues and to, people who would get a chance to look at the video, that hey, a lot more needs to be done as far as mental health is concerned. I mean, talk about facilities, talk about hospitals, that are readily available to support persons with mental health experiences, talk about the prejudice and discrimination that these individuals have to deal with, talk about the challenges that family and friends, the burden of mental health experiences on family, friends, community, society, talk about lack of medications, inability of these individuals to even afford the treatment options that are available for them. And so, indeed, I believe the message was clear. I was just trying to get. I just wish I could just insert the thoughts in my colleagues, mind that hey, we can't do without mental health. I mean, no matter what you do, regardless of your social status, your class, whatever it is that you do, mental health is at the core of our very existence. And so I hope that I was able to.
You really sold it to them, because I mean you can tell by the cheers that they were cheering you. So
Yes.
that's really, yeah. And it brings back to, memories, and again it's going back to the issues that we are going to talk about the diaspora, healthcare professionals and their input, um, in healthcare delivery in Ghana, whichever field that people are able to give back to. And it's so interesting because at that time we just took pictures and did this video, and then we came back, and years down the line, because we wanted to do something again in mental health, and somebody actually said, oh, there's this dynamic young lady who is really enthusiastic about mental health. So we got connected again, and then I sent you some old pictures from Ankafu, and I said, do you know these people? And he said, yeah, that's me in the picture. And then I had to go back to dig more. And then I found this video that you were in debating your way. So you've kept this passion all this time. And I'm so encouraged and inspired. And I've actually looked on your, I mean, followed your work on what you are doing in Ghana, and I think you are doing amazing. And you are doing, great work for the cause of mental health care delivery in Ghana. So keep
Thank
it up. Yeah.
you.
So it leads us to the next question, which is your experience with diaspora healthcare professionals. And I just want you to tell us a bit about your experience, because I know you've met so many different healthcare professionals coming from all over the world in Ghana. And you being the healthcare professional in Ghana, being on the receiving end, can you tell us a bit about your experience with engaging with the diaspora healthcare professionals?
Right.
Yeah.
Thank you for the opportunity once again. My experience working with diaspora and healthcare professionals has been one of a great learning experience.
Yeah.
Um, I've had, like you rightly mentioned, I've had the privilege of working with and around majority, a lot of them. And for the most part, I have always appreciated the new knowledge, the new skills that usually they bring back home to us based on their experience working abroad as mental health professionals as well. And for the most part, it's been through either workshops or trainings or conferences, and it is always so precious to be with them and around them to learn new ways of doing things, new ways of modern mental health care practices. I have had this knowing and also got the opportunity to experience that actually persons with mental health experiences can and deserve to be empowered in order for them to continue living, a meaningful life and to live their best life ever. It is possible for persons with mental health experiences to get well and stay well over their lifespan. It is very possible. I think what we need to understand is that regardless of their experiences, regardless of the symptoms, I mean, any individual experiencing mental health challenges is capable of achieving their life goals. What we need to do as mental health practitioners or professionals is to empower them to take back control of their life. And the way that we can empower them is by, being in a position to, work as peers rather than as experts. If we shift our role from that of experts and rather we see them as peers, we will be better positioned to support them in achieving their life goals. And I speak with confidence about this because you go out there and you see persons with mental health experiences living their best life ever. In fact, if nobody tells you that this person has a mental health experience, you wouldn't know because they are occupying, they are working meaningfully, they are able to contribute, um, to the employment space. They are working, just like you and I, everybody else. And the fact is that they deserve to be included in our communities. They deserve to live a normal life just like anybody else in the community, and they are capable of doing that. But as healthcare professionals, we have a role to play in ensuring that persons with mental health experiences feel empowered enough based on how we are, giving them that space to be able to make decisions for themselves and just be there to support them. Trust me, it is very possible for persons with mental health experiences to live a meaningful life and be able to achieve their goals. Yeah.
Thank you so much. That is all for social inclusion. Social inclusion, it involves a lot. Thank you so much, Pat, for that. So, my next question is, what are some of the pros and cons of working with diaspora healthcare professionals?
In my experience, I mean, diaspora healthcare professionals have always been able to share new knowledge and skills, by way of some of the positive experiences that we have had, you know. And talking about the constraints, for the most part, some of the knowledge or the skills that are shared with us when they get the opportunity to engage with us, it's almost, difficult adapting these new knowledge and skills because of our setting. And the specific challenge is with either logistics or resources that will actually reflect, the knowledge or make it possible for us to actually put into practice that knowledge or skill that has been learned. And so, for the most part, we try to do what we call improvisation.
Improvisation. Yeah.
Provide, yeah, in situations where we are not able to actually put into full operation the knowledge or skill that has been learned from the diaspora healthcare professionals. But I think we're doing well. I mean, in situations where we have not been able to, completely translate the knowledge on the field in our setting to reflect what has been learned. We have been able to just, read around it, keep ourselves abreast with what is expected by way of best practices, and then we've been able to adapt to those changing priorities and still ensure that we do our best and give up, the family and the relatives the best that we deserve. So in my experience, for the most part, engaging with diaspora and healthcare professionals has been beneficial. Yeah.
Yeah. And I think what you said is true, adapting, bringing the knowledge from abroad and adapting it to the local setting. And one of the examples that can readily come to my mind is restraining a patient. When you've been trained that you need at least maybe 4 or 5 people to restrain somebody, and then you don't have the staffing, that can really be challenging.
Yes,
So
it
yeah,
can. I mean, for the most part, we've had situations where you are working on a ward that is female dominated, and sometimes there is a situation on the ward that you need to reach out,
yeah,
maybe more hands-on, maybe real nurses
yeah.
supporting doesn't happen. So I mean, in such an experience, recently we had the opportunity of engaging with one diaspora healthcare professional who came and trained us, had a workshop on the alarm system, the use of the alarm, and I think that was one. It was really a great learning experience for me, because then you realize that the idea of having to sometimes reach out to other wards and get more people to come to the situation. The alarm system will go a long way to support, because but it's just a matter of clicking a button and then you will get more people coming around. So yeah, again, diaspora and healthcare professionals are doing well, and we appreciate the support that they're giving to us back home.
Thank you for that. But out of interest, the alarm system, what do you normally do to reach out? You call, you
Yeah,
make
so
call, yeah.
yes,
If there's an
every ward
incident on the ward,
So every ward has what we call the
intercom.
intercommunication.
Okay, yeah, yeah,
Usually we would reach out using the phone to call the other wards, but I think the phone system also travels through a process. But with the alarm, I'm sure it would improve. Yes,
yeah.
it would improve the communication, because once you hear the sound of alarm, you know that
Run.
sometimes you be phone calling the phone, and if the staff is busy with another client, they may not be readily available to answer the phone on time.
I'm really excited to hear that, and I hope that it will be rolled out soon, and then we'll see how it goes. Okay, so my next question, I think you've answered that question somehow in your previous answers. That what have you gained or not gained personally from diaspora healthcare professionals' input? But I think you've given us some hints here and there about the new knowledge gained, or unless you have anything else you want to add.
Just to add a bit to that, personally, I think that one of the greatest you know um, achievements, I would say, for me has been a shift in perspective around mental health recovery.
Yeah,
As a result of my engagement and interaction with diaspora and healthcare professionals, I have had such an appreciable knowledge in how well persons with mental health experience can recover and take back control of their lives. When I'm addressing my clients and relatives, I have this perspective that, hey, I'm nursing them from a recovery oriented perspective where they are in charge and have a voice in their own recovery journey, and I get to support them in achieving these goals. So again, these are some of the excitement or opportunities that I have personally gained, and I do well to also share with my staff and colleague nurses that I work with. And the way that I do this is in my interaction with clients, their relatives. I emphasize the need to support them in making informed decisions about their own care. It is about them, so nothing about our clients without them. And I usually say nothing about me without me. So we can't be making decisions for the clients. Rather, we can make decisions with them and let them take control of their own care. Yeah.
Wow. I can feel the passion exuding from you. I can feel the passion. I think I've got some. Thank you so much. Patience, what will be your message for diaspora healthcare professionals in general? And I don't want to be biased. I know both of us are mental health professionals, but if you have a special message for mental health professionals too, you can. But what will be your general message for diaspora healthcare professionals?
I want to use this moment to appreciate all our diaspora healthcare professionals who from time to time reach out and connect with us back home, supporting us, based on their own experience working in the diaspora. We appreciate all of your efforts, and we want to encourage you to do more, because all the knowledge, all the experiences you are sharing with us from time to time together is contributing to improve mental health care in general. And so I believe that you're doing so well. We appreciate you, and please don't stop. We look forward to the continued relationship and interactions to improve services. And to my colleague mental health workers, I say mental health, I mean, anyone working in the field of mental health must have experienced what I call a calling or a purpose. Because for me, being in this space is more like living my purpose. And um, I mean, I wear mental health, I eat mental health, I speak mental health, I work mental health, because it is the basis of our very existence. I mean, we can't do anything if we are not well. If we do not have a balance with our mental health, we are unable to, I mean, achieve our goals, deal with the deadlines and everything. It's like our basic existence evolves around a balanced mental health state. If you have a balanced mental health state, you'll be able to do all the other things. There's a lot of knowledge and skills out there, information to support us as mental health practitioners, to improve ourselves first, and then to be able to also support the clients and the relatives that we work with. Remember, as a mental health professional, you always need to, keep it open, keep the knowledge wide open, and be reading and be experiencing and learning a lot, because every day something new happens in terms of how we can contribute to improve life for the clients that we work with. And so this is an invitation for us to be open, to think differently, and be able to do two things differently so that we can get different results as far as our intervention and practice skills are concerned. And so kudos, well done to all my colleague mental health practitioners. We're doing a great job, and keep moving.
Well done. Kudos to you too for all the work you are doing in advancing the cause of mental health care improvement in Ghana. And I know that there's a lot of more of field that you will cover, and you will go from strength to strength.
I want to use the opportunity to also acknowledge the great support that I have received over the years from my hospital director and deputy director of nursing services. I mean, the nursing department and then hospital management in general. They've been really supportive in, creating the space for me to champion what I'm passionate about in terms of my work in mental health advocacy in general. So I want to really appreciate all of the support they give to me, both on site and off site. So thank you to all of you. I appreciate your support always.
They appreciate you too. So thank you so much for the work you're doing to advance mental health care delivery in Ghana. And I hope that we'll catch up again and have another talk another time. It's been a pleasure talking to you. Patience.
Yes,
Thank
I
you.
look forward to